Perianesthesia New Nurse Graduate Onboarding by Julie Cooper, Andrea Joseph, and Kinsley Johnson. Wellstar Paulding Hospital, Hiram, Georgia. With a growing need for nurses, the need was identified to develop a perianesthesia new nurse graduate onboarding process. At the time of this initiative, a perianesthesia new nurse graduate onboarding process had not been established within our hospital system. Historically, new graduate RNs do not work in the perianesthesia environment. We identified the need to bridge the gap between a novice RN and important critical care skills needed to safely work within perianesthesia. The task identified was to determine the appropriate length of orientation based on skills needed and what departments the new nurse needed to orient within to obtain specific skill sets and knowledge needed to safely function as a perianesthesia RN. Utilizing the Johns Hopkins evidence-based practice model as a framework, the perianesthesia management and educator collaborated with the facility nurse residency coordinator to identify overall goals and specific needs for a perianesthesia new graduate nurse. To gain insight into other hospitals' experience, 2 articles were reviewed. Both of these articles were in the Journal of Perianesthesia Nursing, one entitled Rethinking Perianesthesia Orientation, and the other entitled Changing the Culture, Introducing Fledgling Nurses into an Exclusively Experienced Crew. After review of the articles, the department educator and manager collaborated multiple times to discuss the new graduates' orientation framework. We also worked with the facility nurse residency coordinator to ensure all needs were met. Because the perianesthesia department in our facility cares for ICU patients and patients with critical acute needs, it was decided that our orientee would have an 18-week orientation and would rotate through several departments during her orientation. These departments included general hospital orientation, pre-post and PACU, OR, anesthesia, ICU, respiratory, and rapid response. During the 18-week orientation, the orientee was also enrolled in the 9-week Critical Care Nurse Fellowship, which included in-person class, virtual class, and Essentials of Critical Care orientation modules. Time was appropriately allocated each week for the orientee to complete these modules and attend classes and sessions assigned. The orientee was provided an initial competency assessment, or ICA, at the beginning of her orientation, which addressed key skills and knowledge that the orientee must obtain to be deemed safe and proficient to complete orientation. The ICA allows for real-time feedback as to what types of patients and experience the new nurse is receiving. These skills can be reviewed and discussed or completed in real time. The ICA was completed during the 18-week orientation and was completed by the preceptor and the orientee together. The manager and the educator also met weekly with the orientee and the preceptor to complete the RN onboarding weekly eval and needs assessment form. This form details the progress of not only clinical but interpersonal skills between coworkers and patients' families with the orientee. The form has both the orientee and the preceptor identify interventions and skills performed during the previous week, types of patients and procedures seen during the previous week, the orientee's top 3 strengths, and the orientee's top 3 opportunities. Based on the identified goals and opportunities, goals and plans are established that the orientee and preceptor will work on the following week. Based on weekly evals, one-on-one discussions, and overall performance, the new graduate orientee excelled in her perianesthesia orientation. She has continued to thrive in the year since orientation ended, becoming an active participant in shared leadership and precepting students in their clinical rotation. During the orientation process, she provided valuable feedback to management and the department educator that helped to tailor her orientation to specific needs and provide valuable feedback for future perianesthesia new nurse graduates. Thinking outside the box is imperative for nurse leaders to grow their departments and overall skill sets of their employees. We are faced with a challenge of adapting to ever-changing needs within the healthcare field and supplying our nurses with the appropriate tools and skills needed to be successful in their careers. Implementing the perianesthesia new nurse graduate onboarding process has helped to establish a standard for all future new graduate nurses who choose to start their career in an environment that was previously considered off limits.